Hey guys, our grand challenge is engineering better medicine. So first things first, what is the problem this challenge is trying to address? The main problem this challenge is trying to address is developing better systems of medicine for people's individual needs. Each person has a variance in their genetic code that leads to an assortment of diseases. By implicating personalized medicine that fit each person's unique needs, it will allow for the right drugs and dosages they need to be prescribed.
Why did this problem come about? The cost of medical care continues to rise and become less affordable. This is because treatments and medicines are tested in large clinical trials that are costly. With most trials, success can't be measured until the end of the trial after time, money, and resources have been used. Also, treatments for patients are trial and error because medicine is designed for general cases, not the situation of the individual for which it is treating. As a result, if one treatment is successful, a patient has to try another, which may cause financial burden and side effects that result in loss of time from work and school.
What are some challenges creating when finding the solution? So one challenge is testing. So the current gold standard for testing a drug is conducted with randomized controlled clinical trials. Clinical trials are studies that randomly assign people to a new drug or a placebo, which can test how well the drug performs. So this current standard is not the best way of testing whether or not personalized medicine will benefit a person, because a randomized clinical trial shows if the drug is beneficial for the average patient, not a specific one.
Another challenge with engineering better medicine is the general delegation of resources, mainly cost and obtaining a mass of genetic codes. With cost, there's an obvious challenge that arises concerning cost effectiveness with regards to developing personal medicine regimen based on genetic codes. Costs that must be delegated towards a technology that can be utilized for the analysis of DNA will be very high. Um, Additionally, is the expense that the subjects of the testing must pay to allow for the resources to be utilized that are outlined above. With obtaining a mass of genetic codes, in order for this system to work, the genetic code of a substantial amount of people must be obtained. This subsequently poses a challenge with the devotion of time for this research is for such a large amount of people. Due to the fact that there is such a large target audience, organization and execution of personalized medicine plan could be difficult.
What are some potential engineering solutions? Synthetic biology, which is a new field that focuses on how stem cells work and how to regenerate damaged ones. Engineer new ways to deliver medicine by blocking the body's immune system in order to gain access to its desired location. Search for microbes that could be potential disease-fighting drugs, such as organisms living in extreme conditions. Engineer specific counterattacks that effectively combat the parasite's resistance.